Good day, everyone. We'll be going to tackle the eHealth in the Philippine setting. So now, let's dive in. Introduction to eHealth. So, what is eHealth? eHealth in the Philippines refers to the use of information and communication technologies to improve healthcare delivery, health information access, and health system management. It is an internet-linked community where healthcare providers, consumers, and researchers can interact, share information, and access health databases and advisories. Which means that in the Philippines, eHealth means using computers, phones, and the internet to help people get better healthcare. It helps doctors and nurses share information easily so people can get help faster when they are sick. The Department of Health uses eHealth to make sure that all people, even in far places, can get good health care. It helps doctors and nurses make better decisions so they can help people stay healthy. The Department of Health recognizes eHealth as a vital tool to address disparities in healthcare access and quality, enabling better decision making and interventions to support the country's universal healthcare goals. The vision is that by 2020, eHealth would enable widespread access to healthcare services and secure sharing of patient information, transforming health service delivery for all Filipinos. It is like using gadgets to make hospitals and health centers work better for everyone.
Good morning, everyone. I'm John Rose Abunado, and I'm going to discuss the Philippines eHealth system and governance. The Philippine eHealth strategic framework and plan of 2014 and 2020 guides the development and implementation of eHealth in the country. It includes 7 key components. Number 1 is leadership and governance. Number 2 is strategy and investment. Number 3 is the service and application or eHealth solution. Number 4 is the infrastructure. And number 5 is standards and interoperability. And the registration policy and compliance, workplace or human resource. So, any leadership and governance refer to how the government, especially the Department of Health or the DOH, leads the planning, the coordination, and regulation of e-health initiatives. So, the strong leadership ensure the accountability, direction, and collaboration across the different sector or the public and the private sector. So, the strategy and investment, it involves planning long-term goals for eHealth and allocation financially and the human resource. So it is about setting priorities and making sure that there is enough funding and supporting technology and trainings. So number 3 is the service and application. So in the service and application or eHealth solution, there are digital tools used in healthcare such as electronic medical records, EMRs, telemedicine, mobile health apps, and health information system. So this solution helps improve patient care, data management, and access to the service. Sa ako ang nahibalaan sa hospital I was working before, we use I don't know, it's electronic devices that we're going we use in the hospital is BizBox or the file maker. I don't know, it's have the connection with it. So number 4 is the infrastructure, refer to the physical and technological foundation needed, like internet access, computer service, and secure data storage. Maybe this one. And without proper infrastructure, eHealth system cannot function effectively. And number 5 is standards and interoperability. This one is to ensure the different health information system can work together and share data securely and accurately. So this is important data. This important consistency, patient privacy, and system efficiency. So number 6 is the legislation, policy, and compliance. So this one includes the creation and enforcement of law and guidance to protect patient data and ensure proper use of technology. Ensure that all eHealth practice follow ethical and legal standards. So number 7 is the workforce, a human resource. So it focuses on training and hiring people who cannot manage and use eHealth system, including the doctors, nurses, IT professionals, and IT administration. So this one is, every facilities of the hospital, they always have IT. So ug naay problema, dali ra kaayo siya, dali ra tawagon dayon ug naay problema sa computer, about sa BizBox or sa FileMaker, na usually ang FileMaker manggod ang BizBox dinha ginaingkod ang mga data sa pasyente sa pagsulod pa lang daan dinha. So this the FileMaker and the BizBox is siya confidentiality, so dapat kamo lang ang nakahibaloan na sa hospital. So ang IT usually siya ang naga-repair og naay mga tapos example na akay na miss in code or na error ka, so ang sa pana with the knowledge also of the doctor and the staff, nurses and the staffs, with the knowledge of the physician, naga-encode or kanang ginautro gani og example na ay mali. So the IT is a very important na naagid siya sa facility or sa hospital. And also a knowledgeable workplace is the key to maintain and improving the system. So in the summary, the Philippines created a plan to use technology in healthcare. So these plans include the leadership, money, digital tools, internet system, rules, and trained people. So the DOH work with many groups to make it happen. So but there's still some problems like getting anyone to work together and manage project properly. So sa sa hospital dili tanan nagagamit og kanang dili pa sa I heard na ang usa pa na kanang Davao Doc na apay mga mas kuan na mga gamit gani na ginagamit nila sa hospital na wala sa ubang hospital. So high-tech kaayo ang DDH. Okay, that's all for my report. Thank you for listening.
I'm Crisaline Anas, and today I will be reporting about the components and features of eHealth in the Philippines. So first, what is eHealth? eHealth is the use of digital technology like computers, phones, and the internet to support healthcare services. Now, let me explain the main components and features of eHealth in the country. The Philippine eHealth system comprises several components and services. First is electronic medical records or EMR, digital patient records accessible across healthcare providers. These are digital versions of patient health records. Instead of writing on paper, doctors and nurses can now record patient information on a computer. Second, telemedicine, remote consultations and health services, especially important for underserved and rural areas. It means having online consultations with doctors through video calls and chats. Third, mobile health, use of mobile devices for health monitoring and information dissemination. This is the use of mobile phones and apps to help people become more aware and in control of their own health. Fourth, disease surveillance and reporting, online systems for timely health data collection and analysis. This refers to online systems that help the government track diseases and outbreaks. Fifth, electronic referrals and prescriptions, streamlining patient referrals and medication management. Doctors can now send referrals and prescriptions electronically. This means less paperwork, fewer lost prescriptions, and faster service for patients. 6. Infrastructure, high-speed broadband connectivity, national health identifiers for patients and providers, and secure data exchange standards. This part is very important because all the digital systems we mentioned need a strong and secure internet connection and proper data privacy. These components aim to improve access, quality, and safety of healthcare services, allowing providers to make informed decisions and patients to interact more easily with the health system.
Good day everyone, I am Erica Jane Antalan. So today, I am going to discuss the benefits and impact of eHealth. The first one is improved access to care, especially for remote and underserved population through telehealth and mobile services. Improved access to care refers to making it easier for people to obtain the health services they need and also to achieve the best possible health outcomes. Okay, like for example, community resources. Community resources, it is a facilitating connection to community centers like legal aid or support groups. The second one is quality and safety. Better management of patient information reduces errors and improves treatment outcomes. Quality and safety means that health system and services meet established healthcare quality standards such as clinical effectiveness, user experience, and process efficiency. So, quality, it is a delivering healthcare, and then the safety is specifically focuses on avoiding harm to patient from the care intended to help them. The third one is informed decision making. Health managers and policymakers can use reliable data for effective program development and monitoring. It is a process by which a patient gains a clear and comprehensive understanding of their medical condition, like the benefits, risks, limitations, and alternatives of available treatment or interventions, and uses this information together with their own values. The fourth is health promotion. Health promotion. Online health education and e-learning platforms support healthier lifestyles. So, means helping people stay healthy and avoid getting sick by encouraging good habits and creating conditions that support healthy living. And that is a health promotion means. The last is support for universal healthcare. So, eHealth facilitates equitable, responsive, and sustainable health system aligned with UHS goals. So, for my own understanding for this, for this support for universal healthcare, it is promoting the idea that everyone should receive health services without discrimination or financial barriers.
Next is the current initiatives and legal framework in Philippine eHealth. This centered on advancing universal healthcare through digital health transformation guided by updated national strategies and supportive legislation. The Philippine government is actively working to institutionalize eHealth. In current initiatives, we have here the Philippine eHealth Systems and Services Act, proposed and approved by the House Committee on Health, which aims to establish a national framework for eHealth, ensuring cost-effective, secure, and integrated ICT use in healthcare. The Act seeks to improve access, quality, and efficiency of healthcare, particularly in rural and underserved areas. An example of this is A rural health unit in a remote province uses an electronic medical records or EMR system that is interoperable with the Department of Health's national database. So when a patient visits the clinic, their health information is securely uploaded and can be accessed by authorized healthcare professionals anywhere in the country. This enables continuity of care, especially if the patient seeks treatment in another region. So this example shows how the Act promotes the use of ICT to bridge gaps in the healthcare delivery. By making health records accessible and standardized, it ensures that patients receive timely and coordinated care regardless of their location. In terms of legislation, we have here the Joint Administrative Order 2021-002, which was issued by the Department of Health or DOH and the Philippine Health Insurance Corporation or PhilHealth, which mandates the adoption of national health data standards for interoperability. PhilHealth has developed an IT roadmap to implement these standards. Despite these efforts, full legislation is still pending in the Senate, and challenges remain in scaling up and integrating eHealth systems across sectors. An example of this is a private hospital and a government clinic. Both use different EMR systems. So with Joint Administrative Order 2021-002, both are required to adopt the same set of health data standards. When a patient transfers from the private hospital to the government clinic, their medical data can be seamlessly and securely shared, ensuring continuity of care. So this order ensures that the health information system can talk to each other, reducing errors and delays caused by incompatible formats. It supports the goal of a unified, patient-centric health system where data follows the patient, not the institution. In summary, these initiatives and legal frameworks collectively aim to modernize the Philippine health sector, making healthcare more accessible, efficient, and patient-centered through the strategic use of digital technology.
Several challenges affect the full implementation of eHealth in the Philippines. First, infrastructure's gaps. Inconsistent internet access and electricity in rural areas. Poor internet and unreliable electricity in rural areas prevent ICT adoption. Second, funding reliance. Dependence on donor funding limits scalability. Many programs rely on short-term donor funding, leading to stalled scaling beyond pilot phases. Third, technology acceptance. Resistance or lack of training among health workers and patients. Health workers and patients face low digital literacy, resistant to change, and varied EMR adoption levels, often still paper-based. Next, governance and coordination. Need for stronger interagency collaboration and integrated planning. Systems remain fragmented across agencies and LGUs, with weak national coordination and inconsistent implementation. Last, legal and policy frameworks. Pending legislation and enforcement mechanism, privacy laws exist, example, Data Privacy Act and DOH orders, but gaps persist in standard enforcement and eHealth specific legislation. Future directions include continuous capacity building, stakeholder engagement, research and development of interoperable, sustainable, and equitable eHealth system to support the evolving health needs of Filipinos. eHealth in the Philippines setting is transformative approach using ICT to enhance healthcare delivery access and management. It supports the country's universal health care goals by enabling better health outcomes, safer and more equitable services, and improved health system efficiency. While significant progress has been made through strategic frameworks, governance, and legislative initiatives, ongoing efforts are needed to overcome infrastructure, funding, and policy challenges to fully realize the potential of eHealth for all Filipinos. eHealth in the Philippines uses technology like computers, the internet, and mobile devices to improve how healthcare is delivered, accessed, and managed. It helps the country reach its goal of universal healthcare by making services more efficient, safe, and fair for everyone. The government has already made important steps through plans, rules, and laws. However, there are still challenges such as lack of infrastructures, limited funding, and policy gaps that need to be solved to make eHealth fully effective for all Filipinos.